Hi, my name is Rachel Carmichael, and I am going to be performing an exam of the gastrointestinal system. So to start off the exam, I would first wash my hands and introduce myself to the patient. Hi, my name is Rachel, and I'm going to be performing an assessment of your stomach. Can you tell me your name?
It's Claudia.
Claudia, nice to meet you. Awesome. So first off, Claudia, I'm going to just look at your stomach. I'm going to assess for any asymmetry, any masses, anything like that. I don't see any asymmetry. Abdomen appears to be symmetrical. I do see some nevi, some freckles, but I don't see any scars. The skin color is consistent throughout. And again, no pulsations, no masses. Go ahead and lift your head for me, Claudia. Okay, I do not see any hernia, which is great. So now what I'm going to do is just palpate your abdominal aorta. Okay, femoral arteries. All right, and then I'm just going to take a listen to you. So I'm going to listen to the aorta, renal arteries, iliac arteries, and the femoral arteries. Okay, so I didn't notice any bruits whatsoever. So what I am going to do now is just percuss your abdomen just to listen overall for the sound. Okay, and so I hear tympani and resonance throughout. I don't hear any areas of dullness off the bat, which is consistent with normal findings. And so what I'm going to do now is just percuss to assess the size of your liver. And so I'm going to have you take a deep breath for me. All right, let it out. Take another deep breath for me, Claudia. All right, so what I would find on a normal adult is 6 to 12 centimeters for the mid-clavicular line, and then 4 to 8 centimeters for the mid-sternal line. And for Claudia, I did not notice any liver enlargement, which is normal. And so what I'm going to do now is percuss your spleen, which would be in the left, high up in the left upper quadrant. And I can't palpate it, which is normal and is consistent with a normal finding. No splenomegaly that I can tell. And so what I'm going to do now is just lightly palpate your stomach. Just let me know if you have any tenderness. Any tenderness? Mm-hmm. Okay. Now I'm going to deeply palpate. Any tenderness anywhere? Okay, awesome. And then I'm just going to palpate the spleen as well. And again, I am unable to palpate it, which is consistent with a normal finding. I do not notice any splenomegaly whatsoever. So now what I'm going to do is do a Murphy sign just to make sure that there's no liver inflammation or gallbladder inflammation. So what that consists of, Claudia, is I am going to have you take a deep breath for me. Okay, and let it out. Do you have any pain? Okay, take a deep breath for me. Okay, let it out. Any pain whatsoever? Awesome. And so I was able to feel just the very border of Claudia's liver, but I didn't notice it. Claudia denied any pain, so no liver or gallbladder inflammation. And so what I'm going to do now is I'm going to move down to the right lower quadrant, and I'm going to find McBurney's point, which is where the appendix would be, and I'm going to just assess rebound tenderness. When I take my hand off, any pain? Awesome. Now I'm going to do a roving sign. And so what that consists of is just putting pressure on the left lower quadrant and taking my hand off. Any pain? If it was a positive sign, there would be pain noted in the right lower quadrant. Now what I'm going to do is what's called a Soas Test. And so I'm going to have you lift your right leg up, but when you do, I'm going to put resistance on your right leg, and don't let me push against you, okay? All right. Any pain? Awesome. And so no pain was noted, which is consistent with a negative Soas sign. If it was positive, there would be right lower quadrant pain. I'm also, with that test, going to have you turn to your left side. And then I'm going to have you lift up your right leg and pull back. Any pain there? Okay, awesome. And that's also the Soas sign, and there is no pain noted, which is a negative Soas sign. So what I'm going to do now is I am going to do an obturator sign. And what that consists of, Claudia, is I am going to lift up your right leg, bend at the knee, and I'm going to internally rotate. Any pain? Okay, awesome. So negative obturator sign as well. So no appendicitis. What I'm going to do now is something called a fluid wave test. And so what that means is I'm going to have you place your hands, just like that, by your belly button in the middle. And then I'm going to place my hands on either side. And I don't see any fluid whatsoever. And so there's no ascites, which is great. That's a normal finding. And so Claudia, what I'm going to have you do is sit up for me. And I'm going to have you turn and face the wall. So now what I'm going to do is see if I can palpate the kidneys, which I'm not able to, which is a normal finding. But what I am going to do is over the area where the kidneys are located, I'm going to assess for costovertebral tenderness. And if there was any tenderness, that would potentially mean the patient has a kidney stone. Any pain or tenderness, Claudia? Awesome. And so you can go ahead and turn back around for me. So that concludes the gastrointestinal exam. Claudia, thank you so much for letting me assess you today. And so I would, again, perform hand hygiene, and then I would go ahead and finish the exam. Thank you so much.